Okay, folks, so that is quite a good number of folk in tonight, which is absolutely fantastic, and it shows that there's some quite hot topics that we're going to discuss tonight between castration, nutrition and health. So it's great to see everybody along tonight. And this is a webinar series. There's going to be 3 of these webinars over the next couple of weeks, and we're looking at maximising lamb performance. It kind of follows on from the lamb crop that we did last year. We did a series last year as well, where we looked at indoor lambing, outdoor lambing and hill lambings as well. And we really looked at lamb losses last year. We're funded by University Innovation Fund from the Scottish Funding Council. And you'll see there on our screen that we have both indoor and outdoor lambings. So we're not being exclusive to either of them tonight. We're going to cover both. And we've also got on there a hashtag as well. We've got hashtag lambcrop23. So we thought it'd be quite good if anybody is taking to social media during or after this tonight, if you can put the hashtag lambcrop23, it just lets the conversation keep going as well. So I'm your chair for this evening. I'm Kirsten Williams. I'm a beef and sheep consultant at SAC, and we've got a fantastic lineup of 3 brilliant ladies to speak to us this evening. And we're really going to cover a bit of everything to do with lambing. And the idea is that we let you know what current research there is, what new thinking there is, give you some practical tips, and ideally help you increase your efficiency on your farms. It's quite scary, the statistic that goes with lamb losses on Scottish farms, and it's between scanning and lambing, we quite widely speak about this 15 to 20% losses, which is a huge amount of loss, and our aim is really to try and reduce this loss with you guys that are on tonight. So here's our 3 speakers for this evening. We're going to start with Lorna Shaw, who is our ruminant nutritionist. She's going to speak about nutrition. We've got Fiona Crowden, who works out of our vet labs in Craveston, and she's a veterinary investigation officer, and she has got the big topic of lambing without antibiotics. And then we've got Cathy, who is with our behaviour and welfare side of research, and she's going to be speaking about lamb castration. We also have some ROSA points. We've got 2 points have been awarded for this evening. So if anybody is ROSA registered, please, if you can pop Val an email, you can see her email address there. If you can pop her an email with your ROSA number, your full name and your postcode, and then we can get you the 2 points. So I'm going to hand over to Lorna. If I stop sharing my screen, I will bring you on, Lorna. So Lorna is our ruminant nutritionist. If anybody has got any questions as we progress on this evening, please do put them into the Q&A box and we will try and address them as we go. And we also have the chat box there as well. So please, if you feel you want to raise something for everybody, please do put it in there. Lorna.
Right, thanks, Kirsten. So good evening, everyone. So tonight I'm focusing on nutrition for lifetime performance, particularly looking at kind of survivability and getting lambs that good first start, and how the nutrition we give to our ewes pre-lambing can impact that quite heavily. So just if this works, it's not letting me go forward. There we go. So to start, I want to kind of look at why maintaining energy status is key. So when we look at a pre-lambing nutrition, we're restricted by a number of factors. Our kind of first physical restriction is the amount that you can eat. And then within that, we need to provide all her energy and protein requirements within there. Typically, when looking at pre-lambing rations, energy is quite often the first limiting nutrient when we're looking at rations. So this energy, or not enough energy, is limiting the amount we can get out of that full ration for the ewe. And we'll look into this in a wee bit more detail as I go on. So the demands for energy increase around 4 times from maintenance in late pregnancy into lactation. And we can see from my graph in the bottom right-hand corner here that if we look at kind of energy demands of the ewe around 6 weeks pre-lambing, we're looking at about 11 megajoules. And this is just for a 70 kilo ewe carrying twins. when we get up to lambing, it's increased to around 21 megajoules. So it's almost doubled in that period. And then we find it doubling again as we head into lactation. But for the sake of tonight, I'm just going to look into this pre-lambing period. And I'm sure Daniel will take you on into lactation next week very nicely. So energy is an essential component in the diet, and it's also really important for microbial protein synthesis. So our protein production from the ewe is also energy dependent. So both of the nutrients of energy and protein go hand in hand together when we're feeding the ewe. So breaking it down and actually looking at the ruminant digestive system a wee bit more, just to kind of put a bit of background and understanding on what we're eating. So obviously a ruminant is quite individual in the fact that she has a 4-chambered stomach. So she's got her reticulum, her rumen, her omasum and her abomasum, and they all work together to allow the ruminant to digest fairly poor quality forage and make high quality protein. And in the sake of lambing, that ewe is making both meat and milk. So she's responsible for doing quite a lot in this period. So our reticulum and our rumen are our largest part of that digestive system. So that makes up around 85% of the ruminant digestive system. So when we give the animal food, so we're giving our energy, we're giving our protein. The protein we typically supply in a ration is crude, so it's essentially nitrogen. And that gets split between 2 different types of protein. And this will kind of hopefully explain how that split works. So when we first kind of put protein, we get our rumen degradable protein that goes directly into the rumen. So this is the protein that feeds the rumen bugs. But the rumen bugs can only break this down if they've got a source of energy alongside it. So it's important that both this energy and rumen degradable protein are supplied to the rumen for the rumen bugs to fully utilize it and make their microbial protein source, which is one of the main protein sources for a ruminant. And apart from kind of that pre-lambing and lactation stage, the ruminant can pretty much sustain their protein needs with microbial protein alone. However, when we get to lambing, her needs are heightened quite heavily. So she's needing that extra boost, and she gets that from her digestible protein. So that's the protein that bypasses the rumen and goes straight to the small intestine. So it's known as DUP. And that stands for digestible undegradable protein, which is protected from rumen degradation and utilizable in the small intestine. So that leaves it quite available for milk production and fetal production. And that's hence how we see a bit of an effect by that additional DUP supply in lambing time in terms of lamb live weight and also in terms of milk production in both quality and quantity. So it's important that we're providing both a good source of rumen degradable protein as well as bypass protein, and then also energy and balancing this. So the key message for when we're looking at a ration is that it's all about balance, really. We need to balance our rumen available protein supply with our rumen available energy supply, ideally as closely as possible. So in late pregnancy, we're aiming for this balance of protein and energy to be around 10. So the same amount of protein as we'd have energy, and then that is actually boosted by the bypass protein also. So the protein available to the ewe is known as metabolizable protein, and that is typically our microbial protein plus our bypass protein. When we move into very late pregnancy and lactation, due to the ewe's rumen being slightly restricted or quite largely restricted by her lambs, and then are also her rumen passages slightly getting faster in this period, we have a greater need for that bypass protein. And that's why we kind of supplement the extra kind of sources such as like soya, treated rape, treated soya, in that kind of later stage, just to make sure we're meeting those needs as we go on. So we can have an effect. Obviously, we're talking about balance. So I wanted to kind of look at what happens when we undersupply our energy and how that affects the ewe. And then also I'll go on to look at what happens if we actually oversupply energy, because we need to kind of balance this as closely as possible. So an undersupply of energy probably comes as no surprise, as we can see reduced lamb birth weights when we undersupply energy to the ewe. So she's not got as much available for growing that lamb. And typically when she partitions her energy, she'll partition it to her growth of her lamb, her milk, and then herself last. So we'll also see a bit of an effect in probably more of a kind of gross undersupply of energy. She'll start to mobilize her own body condition as well, start taking off her own back to try and put it into her own, her offspring that she's growing. And then also a reduced quantity and quality of colostrum and milk. And this is obviously a big issue around lambing time, especially when we are so reliant on those lambs being born, getting up, having a suckle, getting that first feed, and getting that vital antibody intake that they are so reliant on from their mother. And that's the key for kind of having good, healthy lambs on the floor. So if we have reduced quantity and quality milk, hopefully we've not got, as cute as it is, as many lambs that we're having to bottle feed. So hence why I've chucked this wee guy in here that's having to get a wee bit of a top up because his mum can't quite meet the needs itself. We also have an increased risk of metabolic disorders with twin lamb, with an undersupply of energy, and the most common one there will be twin lamb, which is or pregnancy toxemia, which is stimulated by a gross undersupply of energy to the ewe. We also might start to see a kind of a bit of a increased wastage in terms of our protein. So we saw in the rumen there that we were needing protein and energy together to make microbial protein. So when we've got too much energy and we've not got enough protein, we can only produce as much microbial protein as there is energy there, which means we end up with a bit of an oversupply of protein. That protein can't be utilized by the microbes, so it's then synthesized into ammonia and then excreted through the liver and then out in urine. So we are seeing a bit of protein wastage there if we've not got as much energy in the diet to balance it. So it is important that we're kind of trying to get that balance of the ration as close as possible. An oversupply of energy can also be an issue, and this can kind of build up over time. So it's not just pre-pregnancy. We need to look at the ewe throughout her whole production system. And if we've got an oversupply before we're going into that final kind of crucial eight-week period pre-pregnancy, and we've got ewes overweight, it can cause a big issue. And if this continues on through pregnancy, we start to see the repercussions around lambing time. So quite often with an oversupply of energy, we see an increased level of lambing difficulties or dysocia. So, you know, assisted lambings, lambs coming difficult ways, bigger lambs that we're struggling to lamb, the ewe struggling to lamb herself. Quite often these bigger lambs are also reduced in vigour. I think we've all seen that big dopey single that we just can't get to its feet and can't get suckling. This has probably been the cause, and it's quite often we see these at the end of lambing. So, you know, if we've stepped up the ration and we've got that really nice ewe that was in great condition as we hit the point of lambing, but unfortunately she's actually been fed the 1 week ration for the next 3 weeks, and we're getting that large lamb. This is quite often what an oversupply of energy can lead to. Can also start to see an increased risk of prolapse. I would say here prolapse is not just always bigger ewes or an oversupply of energy. It can be linked to a number of different causes, whether it be mineral. We've seen prolapse on increased levels of dry diets, lying up hills. There's a number of different reasons that might lead to prolapse. So it's not just one of these definite things. And another one is also metabolic disorders. And typically an over-conditioned ewe will also be at risk of twin lamb for a different reason for the under-conditioned ewe, simply because an over-conditioned ewe, there's a number of different reasons, but she's also got an increased fat cover around the rumen, which restricts the amount she can eat. So is she physically capable of eating that energy at the point? A fat, like a kind of more higher body condition ewe will typically eat less than a low body condition score ewe. And then also if we kind of have stress, that can also alleviate these issues as well. So, you know, it might be that she's been in good condition, she's been getting all the energy, but she's not actually able to utilize it, and that's where we're seeing these issues in bigger ewes as well. And this is just a nice picture of what we want to see, a nice lamb getting up, suckling in nice and soon. So that's kind of a nice example of two wet lambs in and seeing mum and getting their first feed. So we can check nutritional status of the ewe, and one way to do this is look at pre-lambing metabolic blood analysis. So typically the advice would be to sample around 10 ewes in a range of body condition scores. So look at lower body condition score ewes as well as ideal body condition score ewes and heavier ewes. So our ideal body condition scores are around 2.5 for a hill ewe and about 3 for a lowland ewe. And we'll do this 3 weeks pre-lambing. So by testing this 3 weeks pre-lambing, it allows us to make small changes if needed. However, we are quite close to lambing, so we can't make any large changes. We need to keep things as consistent as possible. And that is one thing with pre-lambing nutrition, is consistency is key. They don't respond well to big changes or stress events during this crucial period. There is a bit of a opportunity with any ewes that have maybe been, if you've keel marked and you know there's some in the group that are maybe late lambing, there might be an opportunity to kind of fix things there, but it probably leaves the majority of the ewes with not much change, but it can give you an indication if in future, so the next lambing, we can get things a lot better. And this gives a brilliant indication of protein and energy balance. So we're measuring beta hydroxybutyrates, or BHBs, which an elevation of BHBs suggests fat mobilization. So this is your ketone bodies. And then we're also measuring urea, which shows a shortage of short-term ERDP. So are we getting that rumen degradable protein in the ration correct? And then also albumins. So albumins can indicate, so if reduced levels of albumin can indicate a long-term dietary protein deficit. So if they've been deficient in protein for quite a long while, and that has been linked to increased number of lamb deaths and reduced vigor as well. So they're quite important measurements and can give us a good indication of how that ewe is sitting metabolically and what her nutritional status is telling us pre-lambing. So I kind of focused on energy and a wee bit on protein so far, but there is quite a strong relationship between protein and health of ewes and also of lambs. So the protein demands increase similar to energy. Depending, and this increases depending on weight of ewes, lambs carried, and body condition. So it's essential that we're supplying the right amount of metabolizable protein, so protein used by the ewe for her own maintenance, but fetal development, colostrum and milk production also. And 75% of that fetal development is within that last 6 weeks. So this is a really crucial period to be making sure that all these needs are met for the ewe. So great, like large deficiencies in protein, as I was talking about your albumins before, are linked to low birth weights and lamb vigor as well. So this can have a huge effect on lambs when we're getting them on the ground. There's also been quite a lot of research looking at supplementation with additional DUP in late pregnancy, so adding a little bit extra above your main MP requirements. And this has been shown to improve performance and reduce worm shed, particularly to use with low body condition scores. So we do tend to see a greater effect with those low body condition score ewes that are less than that 2.5 mark. Obviously as well, if we can reduce worm burden, we're kind of improving the chance for lambs as well. So it is really good to kind of, maybe pick off those lower body condition score ewes and maybe look at a fecal egg count there as well. So I talked about kind of oversupply and undersupply of energy, and obviously when we were undersupplying energy, we were getting low birth weight lambs. When we were oversupplying, we were getting high birth weight lambs. So this graph, which is actually from Feeding the Ewe, by HDB, which is a brilliant source if you're looking for some further nutritional advice, really just highlights the effect that lamb birth weight can have on survival of the survivability of the lamb. So it just shows that lambs kind of below that 4 kilo mark or above around about 7.4 kilos tend to have a lower chance of survival compared to lambs within that optimum range of about 4 to 7.4 kilos. And we can see it's about a 75% chance of survival within that optimum period. So it is really worth balancing that ration as closely as possible to try and ensure we're optimizing the survivability of lambs, and also making sure they're getting up, getting suckling and getting that crucial first milk. And that's all we're looking for a lambing time. So last but not least, I can't cover nutrition without mentioning minerals at least once. So I've just kind of focused on the main minerals that we're looking for in lambing that kind of have an effect on lamb vigor and lamb survivability. So, and a lot of them actually interlink. So looking at kind of selenium first and foremost, requirement pre-lambing of around 0.1 milligrams per kilogram. So requiring quite small amounts, but very important. Selenium is linked to immunity and works alongside vitamin E quite closely. So if you find deficiency of selenium and vitamin E, it can both lead to kind of things like such as white muscle disease. We also see with selenium increased incidences of mastitis and retained placentas. So obviously a mastitis challenge will reduce the amount of milk we've got available to that lamb. Retained placentas as well is an increased infection to that ewe. So it can have a great effect on lamb performance as well. And then we can also see reduced levels of lamb survival with the deficiency of iodine in turn as well. So there's a link between selenium and iodine as well there. Iodine is required about 0.5 milligrams per kilogram and is linked to a major deficiency can be linked to late abortion and stillborn weak lambs. So it's a really important one to balance in the ration. Iodine's also one to highlight. Toxicity of iodine can actually lead to reduced ability for the lamb to actually uptake the immunoglobulins from the colostrum. So this reduces their antibody intake, which is really key for keeping lambs alive essentially, and optimum performance as well. So iodine's one to watch in terms of deficiency and toxicity. And then not forgetting about cobalt here as well. Cobalt's a really important one. It's quite widely deficient across the country. So it's one to watch out for. But a cobalt deficiency in ewes can impair milk production, leading to weak lambs. It also reduces the synthesis of B12 in the ewe, which is quite important. Lambs are very reliant on their mother for passive transfer of B12, as a lamb actually isn't able to synthesize B12 themselves, so they're requiring it from the diet at that early stage. And lambs from deficient ewes are also often slower to suckle, so it limits that chance of them getting up and getting going. So I think we've talked quite a lot about colostrum, and that leads me quite nicely on to Fiona to talk about reducing antibiotics as well. So thank you very much for listening, and if you've got any questions in the chat, I'll try and pick them up, and I'll maybe pick some up later.
Thank you for that, Lorna. Well done in covering energy, protein and minerals in 20 minutes. It's quite something. While Fiona is getting her presentation up, we'll maybe just fire. There's been a bit of a theme with questions coming your way, so I'll just try and address that just now. And it's really about how to avoid oversupply of both protein and energy. So if somebody's buying in, say, a cake or a roll, how do they go about making sure that they're not oversupplying energy and protein?
So I think the first thing to do is look at your forage, analyse what forage you've got in front, whether you are whether you've got kind of silage, hay, or if you are grazing, is there a chance to do a fresh grass analysis and have a look at how that forage is sitting in front of them. From that, we can actually calculate, how much energy and protein are they getting from that forage alone, and that's the main part of the diet. And then we can kind of predict the needs, what they need from a concentrate from that, and how much concentrate to supply to try and balance that out. It is a little bit more challenging to balance it exactly with a bought-in concentrate, as we are kind of restricted by what we're buying in. But we can kind of work with the forage and try and get requirements as close as possible.
Brilliant, thank you, Lorna. There's quite a few questions in the Q&A, so I'll let you type in some replies and we'll come back to you after all the presentations, so thank you. Fiona, you've got a hot topic, lambing
Have I
without
just?
antibiotics. Over to you.
Brilliant. Thanks so much, Kirsten. So yeah, it's an interesting topic. It's a big topic to cover in 15 minutes, so I shall do my very best. So first thing is bacteria. They are everywhere. They survive in pretty much everywhere on Earth apart from kind of volcanoes. And an interesting fact for the day is that there are more bacteria cells on you and in you than there are cells of your body themselves. So there's about 100 trillion of them, most of them in the gut and on the skin, but you're more bacteria than you are you. Why is that important? Well, when antibiotics are prescribed by a doctor, prescribed by a vet, and given to humans and animals, these bacteria that are on us and in us are exposed to that antibiotic. And obviously this has an effect, which we want it to kill the bad bugs, but the good bugs also get exposed as well, which is quite often why you get an upset tummy. If you're given antibiotics, you're taking antibiotics yourself because you're infecting those gut bacteria. But after exposure to the antibiotics, the resistant bacteria tend to survive, and it's those that predominate after exposure. And then once an animal or a human is populated with the more resistant bacteria, we can then get spread of those resistant bacteria through close contact, potentially poor hygiene, but just, shaking somebody's hand, you're kind of sharing your skin bacteria, touch points, all these sorts of things that we thought about COVID. We're also swapping bacteria through that as well. And we think about animals, they're probably more likely to spread resistant bacteria into their environments, onto pastures, into soils, into lambing sheds. And then those can then get passed to humans through contact with those things. There's lots of bacteria getting spread back and forth one way or another. And it's also in the environment and on our surface. The bacteria are quite free and easy with these genes, the resistance genes, and they're quite happy to swap them and give them to another bacteria. So we can end up with resistant bacteria that haven't been exposed to the antibiotic, but have been swapping genes with a bacteria in the environment who has been. Why is this a problem? Back in 2014, a reasonably generous estimate of 700,000 people died of antimicrobial resistance worldwide. And there's an estimate that by 2050, which is just over 25 years away, and certainly within most of our lifetimes, hopefully, antimicrobial resistance is going to outstrip cancer as a cause of death. So we really, really need to look at when we're using antibiotics, how we're using antibiotics, and really protect them so that less resistance occurs and the antibiotics that we have stay effective for longer. And since 2014, there's been some pressure on the farming community to reduce their use of antibiotics. I'm sure you're all aware of that. And we've done reasonably well, especially the pig and poultry industry have really looked at the low-hanging fruit, and antibiotic use in animals in the UK has pretty much halved. That happened pretty quickly, but you can see from that graph there from 2017 onwards, we've kind of stalled. The low-hanging fruit has been got, the easy wins have been had, and we really need to start looking a little bit harder at what we're doing to start getting those numbers to go down further. So where is that low-hanging fruit in the sheep industry? This is data from 207 flocks from 8 veterinary practices. And there's two main trends that we can see. The first is those black boxes down the bottom of that graph, and those represent oxytetracyclines, which is your kind of dark, orangey, clear antibiotic in the dark bottle is generally what they look like. We can see a fairly year-round trend with oxytetracycline use that probably reflects use in sheep for lameness. That is a whole separate talk, but it's an interesting thing, just as an aside. But yeah, there's lots of ways of attacking lameness apart from use of antibiotics, and that's something, if you're using a lot of oxytet in your flock for lameness, probably worth having a sit-down chat with your vet about how to better manage things. But the elephant in the room is definitely that peak, February, March, massive peak in antibiotic use in sheep. This is sales rather than use. So this is definitely people both gearing up for lambing and in lambing and increasing an antibiotic use in lambing. So that's probably our low-hanging fruit, lameness and use around lambing, hence the talk. So I had a bit of a think about when we can use antibiotics at lambing time. And in the lambs, probably the most significant use is in prevention of watery mouth, which is an infection usually in the first few days of life with an E. coli bacteria. And we're probably fairly familiar with using Spectam, which has been withdrawn from the market. And some of that has led to farmers using injectable antibiotics instead, and some farmers have always used injectable antibiotics for watery mouth prevention. We can also sometimes use the antibiotic nasal spray, your blue spray containing spray, and also probably joint ill treatments if you're having a joint ill problem. So looking at those in more detail, I think there's definitely strides that we can make with managing watery mouth, and a lot of what I'm about to speak about going forward is addressing that. But just to address antibiotic nasal spray just now, nasal sprays with antibiotics, they're not terribly drying, and there's other things out there such as iodine use. If we're struggling to get hold of iodine, we can use chlorhexidine. We can mix that chlorhexidine 50-50 with alcohol. Chlorhexidine is really readily available. If you just ask your vets, they'll be able to supply you with some. Vetricin Super 7 spray, also a different option for navals. So I really think if you are using antibiotics for naval treatments in your sheds, I think it's an easy win to reduce your antibiotic use by using something else. And when we think about joint ill treatment rather than prevention, if you're having a joint ill outbreak on your farm, I think in conjunction with your vet, I think that's definitely, there's a place for antibiotic treatment, not for prevention. There's different things we can think about for that. But if you've got a joint ill problem, then I think you're okay with that just now. Looking at the use during lambing, a big one is oxytetracycline for enzootic abortion. There's two real reasons this can be used. There's a percentage of farmers that will use this every year. Every sheep on the farm gets some oxytetracycline in late pregnancy to manage enzootic abortion. It's suboptimal. We've got a really good vaccine. The vaccine's better than using the antibiotic. It's more effective. And if you cost it out over the lifetime of the ewe, it's pretty much the same cost. And I think we really, really need to look to shift from using Oxytet for enzootic to the vaccine. Having said that, if you don't vaccinate just now and you have an outbreak, there's a place for that during the outbreak and the following year. We're thinking about to prevent infection after an assisted lambing. Again, there's certain farmers who, if they lamb any ewe, will reach for the antibiotics and give them a shot of antibiotic just in case. I think, again, good hygiene, some soap and water ideally, using gloves if you're dirty, even just a short latex glove if you don't like the big long arm length gloves. You should be clean enough when you're assisting your ewe to lamb that we shouldn't be using antibiotics as a replacement for poor hygiene. Looking at things like rotten lambs, retained placentas, stinky discharges, sick sheep, I think you're good to go. That's a sheep that needs some antibiotics. It needs the right antibiotic at the right dose at the right time for the right amount, right duration. But that's definitely something that should be managed using antibiotics. Mastitis, again, generally a bacterial problem. Probably need to chat with your vet if you're having a lot of cases of mastitis. But again, useful use of antibiotics. And as we've covered, lameness sometimes gets an awful lot worse on housing of ewes if you're bringing them in for lambing. There's definitely a place for antibiotics, but there's also a place for other management techniques in there. So again, chat to your vet about that. So thinking about the lack of Spectam, which is probably the hottest of topics, in 2020, there's 7.5 million doses of Spectam sold in the UK. This was down from about 11 million in 2016. And what that says to me that there was a significant number of farmers managed to reduce their usage of it, maybe eliminated it entirely without too much of a problem. And where there is a bit of a problem is that it's estimated about 10 to 15% of farmers are going to use an injectable antibiotic on every lamb that is born on their farm. And there's an estimate of about 50% of lambs getting an antibiotic at birth. And this just puts a really huge selection pressure on the antibiotics for resistance and the generation of resistant bacteria. And the Sheep Vet Society said in no flock will it be appropriate for all lambs to be treated routinely from the start of a new lambing season. Now, that's not to say that some lambs might need to be treated. It's not to say that we might not need to use some antibiotics towards the end of a lambing season, but it definitely should not be every lamb, and it should not be routine. We should risk assess it, and we'll have a wee think about that. And this is why we looked at SRUC a few years ago. We looked at about 300 isolates from lambs. These are E. coli, so the bacteria that causes watery mouth. And half of them were resistant to oxytetracycline. 40% of them were resistant to ampicillin, which is a penicillin, which is your white antibiotic that tends to settle up at the bottom of the bottle and needs a good shake. 40% of them resistant to that. And there's 30% of them resistant to your Spectam. So a number of these farmers and these animals will have received antibiotics, but that E. coli was resistant to them. So it just shows that we really, really can't rely on antibiotics to manage watery mouth. We really need to look at other ways of doing so. And this is the scary one. 25% of those isolates were resistant to 4 or more antibiotics. So these are not bacteria that you want to be taking home and sharing with your family. These are nasty bacteria. If they infect you, cause a problem, they can be a real trouble to treat. So watery mouth, how do we prevent it without antibiotics? And really it's a balance. It's a balance between getting enough good quality colostrum into the lambs in a timely fashion versus the challenge that these lambs are getting from the environment, the E. colis and things from the environment. And Lorna covered colostrum quality really well, so I'm not going to go over the same things. We're looking at, health, nutrition, body condition score. We're getting those right, having good maternal traits and lamb vigor, which in turn is somewhat dependent on lamb size. So particularly big lambs, we need to make sure that they get enough colostrum. Little lambs or multiple births, again, a little bit more attention to them to make sure they're getting enough colostrum to face the challenges they have in the environment. And challenges from the environment, inside lambings and outside lambings have their pros and cons on that front. And yeah, so weather we have no control over, and sometimes we just have to take that on the chin and manage it the best we can. Sometimes that might mean that we think about using a little bit more in the way of strategic antibiotics. Stocking rate, obviously, as our stocking rate increases, there's more feces around, which means there's more E. coli around, which means a greater challenge to those lambs in the environment. Bedding, when it gets wet or dirty, more E. coli, more of a challenge. Stage of lambing, obviously, as things go on through the lambing period, things in the lambing shed can start to just get a bit dirtier towards the end of lambing. So really important at that point to get our lambs out of the main pens into individual pens that are kind of clean and disinfected. And if there's disease present, it's kind of reflecting that we've lost that battle a little bit, and also increases the risk to other lambs in the area. So as these things get worse, as we get more of a challenge from the environment, we need to start thinking about, do we need to use strategic antibiotics in our at-risk lambs? So probably not all lambs, but perhaps your little ones, perhaps the ones that have had a tough lambing, perhaps the ones where mum doesn't have an awful lot of milk, and strategically thinking about which lambs we're using these antibiotics in. So colostrum, as Lorna said, provides the lamb with all their immune cells. We require, depending on the size of the lamb, 60 to 200 mils within the first 2 hours of life, and then 200 mils per kilo in the first 24 hours. So don't hang about. As soon as your lamb's born, get some colostrum into it, get as much colostrum as you can into it, and then it just ensure that the ewes got enough to give them a good belly full of colostrum thereafter. And when we think of colostrum quality, what happens as in when you get poor colostrum quality, the intake becomes quite important. So about 25% of ewes produce inadequate quality colostrum or poor quality colostrum. That's not to say it's useless. There is still immunoglobulins in there. It's still of value. It's just not as good as we would like it to be. And this graph on the left there is a Welsh study looking at colostrum in Welsh flocks. And we can see there in the majority of flocks, 75% of ewes were producing good quality colostrum. There were some flocks where 100% of ewes were providing good quality colostrum. We see down the bottom there, those little dots of farmers that obviously there's a problem there. There's, you know, very few ewes producing good quality colostrum. And in that situation, we can have real problems with neonatal illness. Interestingly, it's the thick, sticky colostrum that tends to be of poorer quality. Again, it's not hopeless, but it tends to be poorer quality. So if you're noticing a lot of thick, sticky colostrum or white coloured colostrum coming out of your ewes, it's just a little flag to say maybe it's not as good as it could be. Maybe we need to think about doing something slightly different next year to look at our colostrum quality. And those colostrum quality tends to be poor in ewes who haven't had their protein needs met in late pregnancy. Was more common where the silage crude protein was less than 120 grams per kilogram dry mass, and it was more common in ewes in poor body conditions. So just going back to what Lorna was saying. And yeah, single bearing ewes, I suspect that's probably because we just tend to not supplement them nearly as much as the twin and triplet bearing ewes for fear of massive singles. And I think those single lambs probably have more opportunity to drink more colostrum, so that actually won't have that much effect on them. So I wouldn't worry too much about the single bearing ewes being of poor quality. But just a quick note about colostrum supplements. So this is your powdered colostrum. That red line that you can see on that graph represents 1/10 of the immunoglobulins that lambs require in the first 24 hours. And we can see that very few colostrum supplements are reaching even 1/10 of the value. So this means they have their place, they are an energy source, but when it comes to providing enough immunoglobulins, what's coming from your ewes is best. So if you do have a ewe with extra colostrum, as long as you've not got a significant Johne's problem within the flock, sharing colostrum between ewes is definitely the way to go, rather than relying heavily on colostrum supplements if you can. I know that's challenging, but if we can, ewe colostrum is favoured. So just to sum up, the only way to reduce the development of antibiotic resistance is to reduce the use of antibiotics. And we should have a good long think about whether we are using them appropriately, when we should be using them. Can we use less of them? Can we use them strategically? And then when you do find a bacterial disease in your flock, speak to your vet. It's usually free. They're usually, I know they're busy, but they're usually, someone will get back to you within the day, and help you treat that infection early, use the correct drug at the correct dose for the correct duration. And that is a huge, huge topic whizzed through. I shall take to the Q&A and answer questions as best I can, unless there's anything that's come in so far.
Fab, thank you, Fiona. I think the two main messages there would be, don't overuse it or you'll break them, and get the colostrum to do the work rather than the drugs to do the work.
That is absolutely it. Yeah.
Awesome. If you stop sharing your screen, Fiona, and Cathy can take control with her screen. Just a quick one as Cathy is doing that, Fiona, but there's two questions I'm just going to combine into one. And it's somebody asking, how do they tell if their colostrum is good quality? And then a follow-on question, what is the ideal reading of a Brix?
In ideal reading of a Brix, so the Brix is the best way to check colostrum quality. I've got a wee slide that I can maybe share at the end showing how to use a Brix refractometer, but in sheep 26.5% is your cutoff using a Brix. It's higher in sheep than cattle because of the higher protein in sheep's milk.
Brilliant. thank you very much, Fiona. There is loads of questions sitting in the Q&A for you, so
I
I'll
will
leave
go and
you
go
to
and
go through
speak to
those.
them.
And Cathy, I will hand over to you to speak castration.
Great, thanks very much, Kirsten. Good evening, even everybody. So what I'd like to do is just give you a little bit of an update on some of the research we've done this year, looking at castration and tail docking. And in particular, we looked at two commercial products that are relatively new. One's a bit newer than the other. So that's numbnuts, which I'm sure most people have heard of, and Clip Fitter, which used to be called Clamp Easy, and it had a sort of change of name. And it was called Clamp Easy when we were doing the work. So some of the slides, and I may call it Clamp Easy, but it's the same thing. But it's just had a name change since we did the work. And this is work that I led on, and Kenny Rutherford, because we ran the studies at the same time, but the two commercial products didn't really want to be in the same shed together. So we had to split them out in terms of who was doing what work. So just to give you a little bit of background, I suppose, to this. So the Farm Animal Welfare Council, who provide advice to DEFRA on animal welfare issues, in 2008 was the last time they looked at lamb castration and tail docking and some of the welfare issues around then. And they concluded that the evidence was pretty much overwhelming, that these are painful procedures for lambs. But at the time in 2008, they also recognized that there wasn't really alternatives that were available for farmers to use that were able to mitigate pain in any sort of reasonable way. And they recommended that new methods to try and deal with the pain that lambs were experiencing should be developed. I think in that they actually said within 5 years, but obviously it's taken until 2022. But they have now looked at this again. In that time, they've also lost the F, so they're now the Animal Welfare Committee. But they, again, looked at the same welfare issues again and looked at whether any of the policy recommendations that currently exist around castration and tail docking practices should be amended. So as part of this work, we were funded by DEFRA to look at two new methods for castration and tail docking, and really to look at how well they worked when we used sort of objective ways of assessing the amount of pain that the lambs might be experiencing. So we looked at these two different methods. So on the left is numbnuts, which I'm sure you're probably aware of and may have seen in use already. So this, the original work for this actually was done in Scotland at the Morden Research Institute, but the product itself was developed in Australia and has mostly been tested in Australia and marketed in Australia and New Zealand. So it is, if you can see in the picture on the left, it is basically like an illustrator, but it has a bottle of local anesthetic that sits on top of it. And the plunger, you can see with a yellow knob on the end, provides a standardized dose in a very specific location at the same time as the rubber ring is placed on the lamb. When it was developed and in Australia and New Zealand, the local anesthetic is lidocaine, but that's not currently licensed for use in sheep in the UK. So when we tested it, we modified it, or it was modified by the makers to deliver procaine instead, which is available for use as a local anesthetic in sheep. So this is essentially a way of putting on a rubber ring and giving local anesthetic in a single action, and the local anesthetic is given as the ring is put on. The second device is the one shown on the right. It's a little bit newer. And this again was also developed in Scotland, also following from some of the research that had been done before. And so this really works like a bedizo. So it's a clamp that desensitizes, essentially. It crushes the nerve and stops the transmission of information from either the testicles or the tail, traveling up and to the lamb by stopping the nerve or interrupting the nerve. And when you place the clamp, it puts one of these little plastic clip that you can see here in the picture which is clamped across the tissue that you want to remove. And then when the tissue dies, in the same way that it would with a rubber ring, the clamp comes away with the tissue. And you can see the scrotum of a lamb here that's come off with the tissue attached. So these were the two different approaches, two different devices that we looked at. So we carried out 3 studies in the lambing season just gone, and 2 of those were in young lambs. So these were lambs less than 7 days old, where currently the legislation says that we can castrate and tail dock with rubber rings without the need to use any pain medication or any local anesthetic. So in one group of lambs, we used numbnuts, and that was used either for castration on its own, for tail docking on its own, or for lambs that were castrated and tail docked at the same time. And so that using numbnuts to carry out those procedures was compared to lambs which had the same procedures, where they would just, we just used a standard elastrator, so the rubber rings were placed and they had no other treatment. All the lambs were picked up, held for the same period of time it would take to place the rubber ring, and then they were put down. So we were able to separate out the effect of being handled from the effect of the pain associated with any of the treatments. In another group of lambs, we used the clip fitter, and here we either did castration or tail docking, but we didn't do the 2 procedures together. And at this point, what we tried to do was to compare it with any of the other treatments or any other ways of castrating and tail docking that might be available on farm. So that was initially just rubber rings on their own without any other medication. So again, as was done with the numbnuts trial. We also used rubber rings, but we gave a local anesthetic, naturally the same local anesthetic as in the numbnuts, so this is the Procaine, but just with a conventional needle and syringe. And we gave analgesics, which are non-steroidal anti-inflammatory drugs, to the lambs. And again, we compared them to lambs that were just handled alone. So in both trials, we had lambs castrated or tail docked with rubber rings, lambs that were just handled. Then we had our 2 different devices, and we also had lambs with rubber rings and local anesthetic given through just a conventional route. For the clip fitter, we also looked at older lambs. So these were lambs that were aged between 4 and 5 weeks of age. And this is, again, reflecting what is often something people want to do on farm, is rather than handling very young lambs. And we've just heard lots from both Fiona and Lorna about some of the issues with very young lambs and lamb survival, and carrying out procedures that cause pain or maybe has an impact on that interaction between the ewe and the lamb is not always a great idea when they're really young. So what could we do if the lambs are a little bit older? And it also often fits into people's routines. If you're lambing outside, it's a lot easier to be gathering and castrating and tail docking at 4 or 5 weeks of age, rather than when the lambs are less than a week old. So in this part of the study, we use the clip fitter again, either to castrate the lambs or for tail docking. Our other treatment is we used our local veterinary practice, and we asked them if we'd come to them and said, we want to castrate at this age, how can I do this to cause the least pain? And so they recommended we used for castration that we use the Bedizo. So that's the clamp that will crush the spermatic cords and the nerves, and that we would give local anesthetic and a non-steroidal anti-inflammatory when we were castrating the lambs, or they recommended a rubber ring and local anesthetic and a non-steroidal when tailing. And again, they were compared to lambs that were handled but had no castration or tail docking treatment. So we had 3 different groups: young lambs treated in 2 different ways, and older lambs that were just treated with a clip fitter. To look at how much pain the lambs may or may not have been in, we used the same methods in all the studies. And we looked at the frequency of behaviors which a number of studies have demonstrated are related or associated with pain. So those are things like rolling, stamping, stretching, getting up and down, those sorts of behaviors, which are pretty reliably known to be associated with pain in lambs. And we looked at those behaviours over the first 60 minutes after the application of whichever castration treatment we were using, or when the lambs had been put down after being handled. And we also used a more novel approach called qualitative behaviour assessment, which is another way at looking at how the lambs are responding. And I'll show you what some of that data looks like in a minute. With ClipFitter, we also looked at any lesions or swelling or skin damage around either the rubber ring or the clip, because again, this is another site where there can be roots for bacteria, because the skin breaks around the application of a rubber ring or potentially around the clamp, the clip. And we also looked at how long it took the lambs to lose the tissues after these different approaches. So I'm going to show you a set of different graphs that show you what some of these data look like. And I'll start with the numbnuts trial in the young lambs, and then we'll look at ClipFitter in both the young and the older lambs. So this is the data when numbnuts was used on just for tail docking alone. And what you can see in the graph along the bottom is the 60 minutes. And this is how much pain behavior the lambs were showing on average over that 60-minute period in little 10-minute chunks. For the lambs that were just handled on their own is the black line, which you can see is pretty much running along the bottom. We wouldn't really expect a lamb that's been handled to show really any pain behavior, and that's really what the data show us. When the lambs have been tail docked with numbnuts, we also see that red line, which pretty much follows along the black line, so it's indistinguishable from a lamb that's just been handled. And when we put a rubber ring on the lamb and we don't give any the numbnuts treatment, we get this blue line, and you can see that there is an increase in pain behavior up to around 10 to 20 minutes, and then it sort of drops back down again. And maybe after an hour, between 30 minutes and an hour, the lambs are showing a similar amount of pain behavior or lack of response. And this sort of time course is what we would normally see when we put a rubber ring on a lamb. So we don't usually see pain instantaneously if you put a rubber ring on. If you think when you put one on, you stretch it to fit around the tissue, and then the ring slowly contracts back to the size it was before you stretched it, or as much as it can with the tissue that sits underneath it. So it doesn't cause pain instantly. It causes pain over a period of time, if you like. And I think the way to think about this sometimes is if you've had a blood pressure cuff, it gets sort of tight, and then if it's not released, you could start to feel the pain and the loss of sensation in your fingers, and it starts to become really uncomfortable. And that's exactly the same sort of pain that we see when we put a rubber ring on a tail or on the scrotum. So sorry, that was a bit of a reason why we see these sorts of graphs, but what you can see here, hopefully quite clearly, is that with when lambs are tail docked with numbnuts, then all that pain disappears. And that's a very significant difference. So that looked like a great story to begin with, but unfortunately, when we then looked at castration, we start to see a different kind of picture. So again, we have our handled lambs in black along the bottom. Again, we wouldn't expect to see pain behavior, and we just see the straight line. But when we use either the rubber ring on its own, the blue line, or the rubber ring with numbnuts, and that's the red line, we see the same pattern of response in terms of the amount of pain behaviors that the lambs show. Typically with castration, we would see more pain behavior, but again, we get this sort of rise in pain to peak around 10 to 20 minutes after the ring has gone on, and then it drops away. But even after an hour with castration, we still don't see the same reduction in pain to the level that we would see when the lambs were handled. So the numbnuts device unfortunately did not appear to be working as well as we would have hoped in the castrated lambs. And if we look at the lambs where they were both castrated and tail docked, so that's the blue line is the lambs which had no pain relief, the red line is the lambs with numbnuts, and the black line is the handled lambs. And we can see a difference between the numbnuts treatment and the lambs without any pain relief. And that pretty much is the bit that's of the pain that's associated with the lamb being tail docked. So we can knock out the pain of tail docking with the numbnuts, but we don't seem to be able to reduce the pain that was associated with the lambs being castrated. And I think the next graph will probably show you that quite clearly. So I think there's a lot going on here, but what this shows you is the total amount of pain behaviors that lambs showed over the first 60 minutes after the application of the rubber ring for the different groups. So the ones that you can see with numbnuts underneath are numbnuts tail docked over on the left in grey, compared to the handled lambs also in grey and tail docked without any pain relief. And then we get over to the castration group. And again, you can see that when we consider that all the pain behaviors that the lambs show in those 60 minutes, there's no difference between numbnuts and no numbnuts. And if we look at castration and tail docking, we can see that the numbnuts treatment is lower than the black bar, which is the castration and tail docking together. So some impact on mitigating pain in numbnuts, but not particularly effective against castration, unfortunately. So the next set of data, this is some of the qualitative behavioral assessment data. Again, it shows you much the same sort of thing, and I think it's easier to see in a graph I'll show you later. So I won't spend a lot of time on this one, but really it shows us the same. Whether we look at the behavior in one way or another, we still see that there's more sort of restless type responses in the castrated lambs, and the lambs that were tail docked or handled, tail docked with numbnuts or handled, show these more relaxed, comfortable behavioral responses. So I'm now going to show you some of the data from ClipFitter. So I have displayed the data in a slightly different way here, but what you can see for the young lambs is the same kind of time course of the first 60 minutes. And this looks at how much pain behaviors, again, that lambs are showing. And it does reflect, particularly if we look at the dark blue lines, the same trend that we saw with the rubber ring castration for lambs, where we get an increase in pain behavior and then it decreases over time. And in this study, when we gave local anesthetic with in a conventional way, we were also not able to mitigate the pain that we saw with the rubber ring. So that's the sort of mid blue line. However, the handled lambs are shown here in green, and the clamp easy or ClipFitter in red, and you can see that both of those for the castration and tail docking are pretty low. So when we use the clamp, the red line, we don't get those sorts of pain behaviors that we see when we put a rubber ring on our young lambs. And when we look at the tail docking, again, we get a very similar sort of response, low levels of pain to begin with, and that pretty much disappears within the first sort of 10 minutes. So these are the data from the young lambs. So very significant pain behaviors when we use a rubber ring, even when we give local anesthetic, but low levels of pain behavior when we use the clamp or the lambs are handled. The next graph is going to show you similar kind of data, but for the older lambs, where we didn't have the same sort of rubber ring treatment, which isn't legal in the UK in lambs at the age in which we were castrating them. And you can see that we don't get that high level of pain behavior because we're not using rubber rings. But if we compare the red line, which is the clamp castration, with the dark blue line, we get a little bit more pain behavior immediately after castration or tail docking. But again, within the first sort of 10 minutes, that's pretty much indistinguishable from the handled lambs and much lower than we would see if we had used a rubber ring. So the next graph is quite busy. So this is the total amount of pain behavior for all the different treatments that involved the ClipFitter. So the data in the box, the red box, is all the data that was taken from the young lambs, and the data on the right-hand side of the graph is all the data from the older lambs. And again, it sort of shows the same kind of story as we were seeing when we looked at the time course, that if we summarize all the pain behavior over the first 60 minutes, the total numbers of these sorts of behaviors, the 2 bars on the left-hand side are where we used rubber rings to castrate the lambs, either with or without local anesthetic. And then we have clamp easy or clip fitter, and the handled lambs being almost exactly the same. And the lambs that were either tail docked when we gave local anesthetic or using the clamp, again, are at the same level and much lower than we see for castration. The group of lambs over on the right-hand side, we can see that we did a much better job, or it was much easier to mitigate the pain associated with castration using local anesthetic. And that was able to reduce the pain in these older lambs when used with the Bedizo to the same level as we saw with the handled lambs. But we were able to get quite close to it just using clip fitter and nothing else. And when we looked at tail docking, either by using the clamp, the clip fitter, or by using local anesthetic with a rubber ring, we had the same level of pain responses in our lambs by using the clamp, and no pharmaceuticals, no drugs, if you like, as we did if we gave local anesthetic and non-steroidal anti-inflammatories. And this just shows some of that more qualitative behavioral responses, which we might think of as lamb's demeanor, if you like. And each of the little dots on this graph shows response for single lamb. And if they were the rubber rings are shown in the purple triangles, which are all over on the left-hand side in the restless, agitated, painful group. And that is the dark blue circles are also rubber rings, and this time with local anesthetic, which in these very young lambs, in this study, we did not find to be very effective in addressing pain. And then the green diamonds are all our handled lambs, and the green diamonds are our clamp lambs, and the red squares are our control or handled lambs. And you can see they're all over on the calm, comfortable, relaxed side of the diagram. And they were sort of split out pretty much between lambs that mostly lay down and lambs that were up and playing or engaged in with each other, playing with each other, or investigating the environment. So we were able to split out the treatments really clearly using this sort of method. And it shows us that the clamp and the handled animals were comfortable, calm and relaxed, and that the lambs where we used a rubber ring were restless, agitated and painful. So just to conclude what all that data means, it showed us that the numbnuts device, when used with Procaine, was effective against the pain associated with tail docking in our young lambs. And essentially the pain behaviors that we were measuring were equivalent to those that we saw in lambs that hadn't been tail docked at all. However, the numbnuts was not effective against the pain associated with castration in these lambs, and we saw no reduction in pain behavior at all when we compared it with the rubber ring without any local anesthetic. The clip-fitted device was effective in reducing the pain associated with castration and tail docking in both our young lambs and in the older lambs. And the responses we saw were either better or equivalent to those that we saw using a local anesthetic, Procaine in this case. I haven't showed you the data, but the tissues were also shed more quickly with the clip-fitted device compared with the rubber ring. And the lesions, so the amount of inflammation or swelling or broken skin and scabbing that we saw was smaller or less significant than we saw when using rubber rings. So I think that's the main sort of story, I suppose, from this. So there are some methods that are currently available now that seem to be able to mitigate pain associated with castration compared to using rubber rings alone. And that's the information that the DEFRA now have to try and make a decision on what they're going to advise in the future. So I think that's probably at the end of what I wanted to say. I'll stop sharing.
Brilliant. Thank you very much for that, Cathy. I think this time last year, we actually had you along to our Lamb Crop 22, and Clip Fitter was just really getting started. So it's really good just to get that update of where you are with it. There has been so many questions coming in, and Lorna and Fiona, you have been typing away and trying to address them. I'm going to give you a little minute to recover, Cathy, because there's quite a lot coming your way. Fiona, if you're in hiding, can you come back to us? You have done a huge amount of typing in the last 20 minutes. There seems to be a bit of a theme that is unanswered. I think they're in the chat rather than QA, all about iodine. And shall we talk iodine?
I missed all of them. Yeah.
So there is around, what if you can't get iodine? We've not talked that one. And how best is it to actually apply the iodine in an iodine cup? And if so, in an iodine cup, are you best just to keep topping it up, wash it out, or how should you manage that cup?
Okay, so there's always a bit of certainly the last few years, there's been a bit of a chat about there not being enough iodine. So iodine is good because both disinfectant and drying. And there's nothing quite as good, but there's a lot of things that have been shown to be nearly equivalent to iodine. So we want an iodine solution of over 7%. Anything less than that, and that's not going to be as effective. Alternatives, chlorhexidine 4% solution. Chlorhexidine really commonly sold as Hibby scrub, but if you go into your vets or your agricultural merchants, they should know, if you say chlorhexidine, they should know what you're talking about. And that can be used either as a 4% solution or mixed 50-50 as a 4% solution and alcohol. There is a solution called Vetricin Super 7 Plus, and again, rough equivalents with iodine, not quite as drying, but it has rough equivalents with iodine. So there are other things out there that have been shown to be reasonably effective and just about as effective as iodine. So that's that. If you can get your hands on iodine and you're applying it, cup is probably the best way because you can get the iodine properly around all of the aspects of the navel and all the way up the umbilicus. I would change it certainly anytime it looks dirty, because that suggests it's getting contaminated with a lot of environmental bacteria. So change it totally. I would try not to top it up because you will just end up with that kind of keeping that heavy residue of dirt in the bottom of the cup. So tip it out completely and change it totally. And I don't think there's any fast rule of thumb, but yeah, probably every 50 lambs or so, I would imagine.
Brilliant. And just quickly, why is there potentially an iodine shortage this year, Fiona?
I think, is it mined in Chile and there's a shortage? I can't quite remember. I think the Chilean iodine miners are on strike or something, and there's only one big mine that produces the iodine. That's
a fashionable thing, isn't it? Going on strike. Cathy, there is oodles upon oodles of questions for you, and I've been trying to kind of bring them together so there's less firing at you. But let's start with lidocaine versus procaine. Yep. There's quite a few questions around that. Is one better than the other? And
I just started typing an answer, but it's probably a lot easier for me just to speak about this. So yeah, I mean, lidocaine is generally better than procaine, and there has been quite a lot of discussion about why lidocaine is not available in the UK when it is in places like Australia and New Zealand. And in fact, we import products from these countries where the animals may well have been exposed to these drugs. So why can't we do it in our own country? I think the issue seems to be that there is some research, probably mice, maybe, I'm not even sure which species, have showed that there has been some of the, when the product is broken down, it produces some compounds that in some studies have been thought to be carcinogenic. But there's no real evidence whether this happens in sheep, whether it stays in the meat. If you've used it in a young lamb, the chance of it still being present in the meat when you are likely to be eating it is tiny. So there is a move towards trying to encourage that lidocaine for all sorts of reasons, not just for tail docking and castration. In fact, we sometimes use it under the cascade anyway, so to try and get rid of that. So that number one, lidocaine is a better drug than procaine and should be more available generally for use in sheep for all pain that the sheep might experience. The other issue is whether did the numbnuts trial not work because we use procaine? And the answer to that is no, because if you go and look at the literature, as we did later from the Australian studies, which used lidocaine, they only show an effect of numbnuts when they mark the lamb. So when they do tail docking and castration together, and they show that same reduction that we saw if we take out the pain associated with tail docking. I mean, the makers of numbnuts are aware of this, so it's not like I'm telling them something they don't already know. So they know they have a problem with it and they are trying to fix it. So maybe in a year or two's time, numbnuts might be tweaked a wee bit so that it's now working better for castration. It's brilliant for tail docking. If you only tail lambs, I would absolutely say use this if you can, because it works. And, you know, we've shown that even with procaine, it works really well. But there is an issue with numbnuts in terms of castration and getting, whether it's about getting the local anesthetic into the right place or getting enough of the local anesthetic in the right place. So it's hard to say exactly why it's not working as well as it might at the moment. But I don't think it's just because we're using well, I'm certain it's not just because we're using procaine, because the data from Australia tells us the same thing when they use lidocaine.
Okay, and there's a few questions as well, Cathy, asking, are both ways readily available within the UK, and are they legal to use with the likes of QMS and Scottish Government? So that would be clip fitter and numbnuts.
Yes. So interestingly, so numbnuts is, now you're asking, I mean, it would be legally used because you're giving local anesthetic, and that we're allowed to castrate with local anesthetic. I suppose you would have to argue whether is it effective when you castrate, and it isn't. So I probably wouldn't say why would you use it for castration at the moment. You'll be spending money and time on something that's not making any difference, unfortunately. But for tail docking, yes, definitely it is. Clip fitter is an interesting case. So the legislation between Scotland and England and Wales is slightly different. So we took some advice from Scottish Government lawyers before we did this work, and clip fitter is legal to use in Scotland. Because of the way the legislation is worded in England, it's not, unless you're doing them when they're really young. And again, this is something that we've asked, why do we have slightly different wording in our legislation, and can we not just make it simpler and more straightforward so everybody understands what we can do? So if you're in Scotland, absolutely, clip fitter is it is commercially available. You'd have to go to, I think it's called Lambkind. We just tested it, so I don't sell the stuff. I think he's called Brian Eady here. And it's called Lambkind, and he will talk to you about it. And they have different clips now as well. So he has some small clips, some larger clips, some biodegradable clips. So there's lots of sort of development in that area. So if you're interested, then he would be the person to speak to. But yes, it's commercially available and it is legal to use it in Scotland.
Okay, great. Final question for you, Cathy. Talk to us about hot gas irons and detailing.
Yes, I have never seen them used, and we've done no work on them, but the literature suggests that the hot iron is, well, it's effective. It doesn't seem to cause a big pain response in the lamb, and it has the advantage that you can, you're cauterizing the wound. But we've never used it, and we've never done any work on it ourselves. But from what I've seen in the literature, it does seem to be a possible option. Yeah, it's certainly less painful than putting a rubber ring on. I think the data shows us pretty clearly, if you put a rubber ring on, it really hurts. If you can find anything else, any other way that you can do that, please do it, I would say.
Fab. Good stuff. Lorna, I'm going to come to you now. You've been quiet for a minute. So there's somebody that is feeding neeps currently to their sheep pre-lambing, as well as the usual quantity of cake. How much can they reduce their cake if they're feeding neeps ad lib?
So first, I'd probably want to kind of just get a prediction on how much neeps the user actually intaking. So if you were looking at a kind of turnip in comparison to barley, for example, they'll roughly eat about 5 kilos of turnip to 1 kilo of barley. So, and that would be the same replacement in terms of energy. So if we can predict roughly how much neeps they're eating, we can get a good prediction on how much cake we need to meet that energy deficit, or if they need cake at all, providing, you know, is there additional forage available as well? You know, are they actually needing that extra? The one thing to watch with that is you've got a really high starch source, you've got a really high energy source. That's where we probably would need additional protein to meet our protein needs as well. So trying to balance both.
Brilliant, thank you. And Fiona, you have been typing all these answers here, and hopefully everybody's seeing them popping up on the screen, the questions with the answers. But there is a lot of questions on colostrum, so let's talk colostrum, and mostly around how we store it, how we defrost it, where we get it from. Is it cow? Is it yow? Talk to us.
Yes, so yow colostrum best from yows on the farm. Cow colostrum you can use. There's occasional cows that produce like an anti-sheep antibody, which if you give that colostrum to a lamb can cause anemia, which is obviously suboptimal for lamb survival. So if you can pool cow colostrum from many cows, then that dilutes any antibody out and reduces the risk of that happening. So that's what I would do with that. Colostrum storage, as long as you collect it cleanly into kind of clean hands, clean teats, clean container, it'll store in the fridge quite happily for a week. You can freeze it 6 months to 12 months, depending on who you ask, but probably 12 months is fine as long as it's a freezer that's not regularly opened. And yes, defrost at room temperature, or if you're putting it in water, make sure you dip your baby in the same temperature of water, no hotter than that. So yeah, and then yeah, feed it to the lambs as quickly as possible after birth.
Never use a microwave.
Never use a microwave. Preferably don't you put it on top of the agate either, unless that's where you'd perch your baby, in which case it's fine.
Brilliant. And I wonder if we just do a quick round robin, and I'm going to do it in the order that we have gone tonight. So Lorna, I'm afraid I'm going to put you in the hot spot, but if you've got one take-home message for folk coming up to lambing time, what would it be?
One take-home message, that's a difficult one. I think when it comes to nutrition, you know, just look at what you've got in front of you first. Forage is key, and balance from then on in. And just a wee reminder as well, take a minute for yourself. A healthy stocks person probably helps at lambing time as well. So, you know, that can go a long way to lamb survivability as well. So, yeah, take a minute.
Brilliant. Fiona?
I've got a one-word answer. Colostrum. Get that right. If you get that right, a lot of problems go away.
Says it all. And finally, Cathy.
So I would completely agree with that, of course, but I suppose to stick with my own topic, I think I would probably look at your lambing flock and think about whether you need to castrate or tail dock at all. That would be my starting point. There's more and more people are starting to not castrate now. If you can get your lambs away before puberty, or you can keep them apart, you know, you can get all, you can ignore everything I've said because you don't need those things. And if you can do that, none of these things are pain-free. So you're always going to cause some pain. And really, we're looking at how little pain can we get away with. And the only way you can avoid all pain is not to do it at all. So if you can, and I know that not everybody can, but if you can, it's definitely worth thinking about not doing it at all. If you have to do it, then thinking about some of the, you know, just being aware that there are other ways out there than always putting rubber rings on. And, you know, there might be other ways that we can do this better. And that there certainly are, you know, it's better for the lamb, but it's also better for, I mean, nobody likes ringing. You're always bent over, it hurts your back. If you don't have to do it, why do it? So think about whether you have to do it at all.
Brilliant. Some great top tips there. I've also just put into the chat a link for EuroSheep, which is a website that's got loads and loads of different tips and tricks from loads of different countries within the EU as well as the UK. So it's well worth you going and having a look on there. So tonight we've looked at maximising your lamb performance at lambing time. Next week, we're going to move to Wednesday rather than Tuesday. So it's Wednesday at 7:30, and we're going to look at the first 8 weeks. So really, while that lamb is on the mother. We've got, again, a great lineup of people. We've got Daniel Stout, who is one of the SAC sheep and grassland specialists. We've got a researcher in Joe Connington, who's going to speak about breeding out mastitis. And then finally, we've got a fantastic farmer joining us next week, and Duncan Nellis is going to speak about how he manages his flock. So please do register and tune in. I will send round the link for that one to everybody who's been on tonight. And thank you to you 3 fantastic speakers and for answering all those questions, because there's been so many of them. And I wish you all a good night. Thank you very much.
Thanks, everyone.
Thank you.
Thanks, everyone.
Bye.